হার্টের অনিয়মিত রিদমকে নিয়মিত করতে পেসমেকারের কথা আমরা সবাই জানি। সেই পেসমেকার এখন অনেক আধুনিক লিডলেস পেসমেকার এসে গিয়েছে, কিন্তু সেখানে অ্যাড হয়েছে কন্ডাকশন সিস্টেম পেসিং। এই পদ্ধতি আরও অনেক বেশি ন্যাচারাল, হার্টের ন্যাচারাল ফ্লোকেই যন্ত্রের মাধ্যমে কিভাবে একদম ঠিকঠাক রাখে কন্ডাকশন সিস্টেম পেসিং। হোয়াট ইজ দ্য ফিউচার অফ কন্ডাকশন সিস্টেম পেসিং জেনে নেব সিনিয়র কার্ডিওলজিস্ট ডক্টর সুন্দরমের কাছ থেকে।
So we know that there are some electrical wires which stimulates the heart for a normal beat. So when these wires are in fault, the patient will have a reduction in their heart rate and they'll develop symptoms. So for this we do pacemakers, and we are doing it for almost like years together to put the upper chamber leads in the right atrium and the lower chamber leads in the right ventricle. But over the last few years, we have learned that putting the lower chamber leads in the right ventricle can produce some sort of breathing difficulties and heart failure symptoms in nearly 10% of the patient. So we have learned to switch over from that conventional side to connect the leads directly to the electrical wires of the heart. When you have a problem in the electrical circuit, rather you repair that circuit rather than adding one more circuit or wire to an abnormal site. So here the leads will be directly implanted right into the electrical wires of the heart so that it will mimic that natural cardiac activation. In that way, it reduces your heart failure symptoms, your breathing difficulties, it improves your cardiac functions. In patients with heart failure, when the heart is already failing with probably some sort of electrical disturbance, when you do this conduction system pacing, it will recover and the patient will regain their normal left ventricular function. So in the future, we are going to have a better implantation tools, because right now whatever we are having it been adapted from the previous decade tools. So in the future, we may be having a specifically designed tools which can be used for doing conduction system pacing, and we may be merging the available technologies. For example, we have to put a defibrillator lead for patients who have a faster heart rates and recurrent syncopes, but the defibrillation technology will be merged with the conduction system pacing technology in the future. Similarly, the patient may be getting a leadless device or wireless pacemakers when there is some difficulty in getting into the veins or because of some infections. In the future, again, the conduction system pacing will be merged into this leadless, so that we will be having a leadless conduction system pacing.
ডিভাইস আপডেট 2025 থেকে ক্যামেরায় রণদীপের সঙ্গে তিয়াস, দ্য ওয়াল।